Hi guys. Seeing this tooth, have you ever wondered why the patient came for removal of this tooth and for implant placement? Now, to answer this, let's go and have a look here. So, this is a tooth that is the lateral incisor. There is infection, but why? So this is our endodontic post, and this is root canal filling material. So that is short of the apex, which is resulting in inadequate apical seal. That is, it's not completely locking the apex. It's open from this side, because of which the bacteria is entering and causing infection. Now, the thing which you can see here, this canal, I'll show you the same on other section. See here. If you see my cursor, this is the canal which is not filled, and this is one more necessary canal. So this results in infection. Thank you.